As I wrap up the series on providing tips to code from the operative report, I will leave you with this week's one final tip. And it's an important tip. You need to know about the surgical package. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, we provide you with information, tips, and strategies on how to become a certified marketable medical coder. Did you know that there is no standard definition of a global surgical package? We will talk about this in a bit. Now, CPT does have a surgical package definition that is listed in the surgery guidelines, and coders need to have an understanding of what is included in the general surgical package. The items that are included in the surgical package are not separately reportable or billable. Each CPT surgical code includes the actual procedure and the following services: an evaluation and management service subsequent to the decision for surgery on the day before and or day of surgery. This would also include the history and physical. Local infiltration, metacarpal, metatarsal, digital block or topical anesthesia, immediate post-operative care, including dictating the operative notes, talking with the family and other physicians or other qualified healthcare professionals, writing orders, evaluating the patient in the post-anesthesia recovery area, and the typical post-operative follow-up care. Now, keep in mind that for certain procedures, other services or items may also be included. And that is where knowledge of the guidelines for the specific procedure comes into play. I mentioned earlier that there is not a standard definition of a global surgical package. Why, you might ask? Well, because services that are included in a surgical package may differ for each third-party payer. For example, what Medicare may include, United Healthcare may not. It is important to become familiar with the various third-party payers' reporting and reimbursement policies as they relate to the global surgical package. Surgical procedures have three phases: the preoperative service, the intraoperative service or intraoperative work, and the postoperative service. Medicare's preoperative and intraoperative definition actually mirror those in CPT. However, CMS's definition of postoperative services differ from the CPT definition, and it's more expansive and includes the following: all additional medical or surgical services required of the provider for complications which do not require additional trips to the operating room, follow-up visits that are related to the recovery from the surgery, post-surgical pain management, supplies except for those identified as exclusions, and miscellaneous services such as dressing changes, local incision care, removal of operative pack and cutaneous sutures and staples, lines, wires, tubes, drains, casts, and splints, oh my, insertion, irrigation, and removal of urinary catheters, and routine peripheral intravenous lines and nasal, gastric, and rectal tubes. Every surgical procedure is assigned a global period. The global procedure is a period of time starting with a surgical procedure and ending some period of time after that procedure. Many surgeries have a follow-up period during which charges for normal post-operative care are bundled into the global surgery fee. It can be 0 or 10 days following a surgical procedure for minor procedures or endoscopies, or it can be 90 days for major surgeries. If you want to know more about coding from the operative report and missed any of our videos in this series, check out the videos linked in the description box below. Also, if I can help you along your coding journey, feel free to stay in touch with me. I provide a free course on the 5 steps to become a certified marketable medical coder, and you can check out that link in the description box as well. Hope this series has been helpful for you. I love hearing from you, so let me know your thoughts in the comment section below. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. Reminding you to be safe, be kind, and don't wish for it, work for it. And don't forget, if you are not part of our community, click that subscribe button and that bell for notifications when we upload new content. Make sure you check out some of these videos on the side. We have a lot of information that may be of interest to you. So until next time, take care.